Hey guys, so I want to talk to you a little bit about today's topic, which is, are there side effects of restorative therapy options? Restorative therapy is when we use medications to try to stimulate our body's ability to produce testosterone through the testes. And we use medications like Clomiphene, or the trade name is called Clomid, and Clomiphene is what's called a selective estrogen receptor modulator. What that does is it basically stimulates your hypothalamus to then produce more testosterone through the pituitary gland by higher stimulating hormones. HCG is also another medication that we can use to stimulate the testes. But there are some side effects that you got to be aware of. One of the more common side effects, especially at higher doses of Clomiphene in particular, can be headaches. Some people can experience some nausea, vomiting. I've seen patients feel a little bit emotionally unstable, where I jokingly say they may cry at a Hallmark movie. So they just feel like they're a little bit more in tune with their feminine side when they're on higher doses of Clomiphene. HCG is generally well tolerated. The difference there is HCG is an injectable, whereas Clomiphene is a tablet or a capsule. And so you can obviously get some injection site irritation with HCG. Some people will get a little bit of nausea and emesis, or where they feel like they may throw up when they use HCG just from the injection itself, which is very, very uncommon. Some guys, when you start to stimulate the testicle to produce testosterone, will actually get a little testicular pain. So that's something to be aware of and to communicate with your provider. In general, I will tell you they're very well tolerated. Now, one of the things that I do see, though, that this is really important for you to understand, is if you're in a situation where you're using restorative therapy and you're doing it so that you can protect your fertility or maintain that fertility, oftentimes if you've been on those medications for extended period of time, let's say 6 months, a year, we may have to start adjusting doses because there tends to be a little bit of a resistance, meaning the dose that we started you on that got the result may not be the dose that we keep you on to continue to stimulate that feedback loop so that your testes produce testosterone. So it's just something to be aware of if you start to feel like my symptoms are starting to come back after I've been on these restorative medications for 6 months to a year. It may need to be discussed because you may need a dose adjustment because of the resistance that sometimes happens on these medications. If you have any questions, please feel free to email us at info@optimizehealthnow.com, or you can go on our website, optimizehealthnow.com.